Welcome back. Well, are you looking for options to replace your missing or unhealthy teeth? For those fed up with or fearing the thought of dentures or partials, Hybridge dental implants can be a great alternative.
Joining us is prosthodontist Dr. Matthew Nawrocki. He's here to talk to us more about replacing and missing teeth with Hybridge. But let's start with this, Doc. Let's go back to what the cause of having to get a whole new set of teeth is. What happens when the teeth fall?
There's a whole host of events that happen, and this affects people in many different ways. When you lose a tooth, even one tooth, one of the first things that happens is you start to lose bone. The only purpose of our jawbone is to hold teeth, and so the body's not going to waste energy on something that has no purpose. So you begin to lose the bone, and then as you lose more and more teeth, you lose more and more of this bone, and that can cause that sunken, collapsed, presence of the face. It gets kind of that so-called old maid kind of look there. So it can make it very aging, falsely so, affects the aesthetics and all that, but it also has other effects on your health. It can make it hard to eat certain foods, the nutritious ones. If you're in dentures, they chronically get looser and looser, and it's uncomfortable, it's painful. It affects people in social outings. They're just, they're not comfortable. They don't feel confident with themselves, so they certainly can't do all that and interact, and it affects their their health and chewing, and they have to eat the foods they can eat versus the foods that they want to eat. So it has a whole sequelae of events, and it's very aging, and it's very detrimental to people.
Let's get into the benefits of Hybridge.
Yeah, so for those people who are missing all their teeth, or really, if we really look down on it, and it's we really need to get these teeth out. There's just no really good options. And for someone who wants to help preserve that bone from so it doesn't continually lose, so they can eat, so they can smile, so they can feel confident, Hybridge is a good solution. It's a dental implant solution that replaces all of your teeth on whether your top or bottom jaw or both, and it allows people to kick back as close as humanly possible to when they had all their teeth. It really gets back to that. With dentures, you're functioning generally around 10–15%, maybe at best 20%. This allows you to get way back up to that 90–95, even it's like it was when you had all your teeth.
So, and we've talked about this before, Hybridge isn't just for, you don't have to wait till you're wearing dentures for a while and then you can replace everything. You can do one-offs, right?
Exactly. So certainly for those people already missing all their teeth, or they need to, we need to get all the teeth out, it's a wonderful solution. But for many people, when we sit down with them, we're trying to help preserve and be conservative. So if a lot of your teeth are healthy, maybe you just need to replace a tooth or maybe a couple teeth, the Hybridge protocol works well. It's really, think of it as a protocol system. It's an efficient protocol system that allows you to get from point A to point B in the most timely and cost-effective manner possible. And so for a lot of people, it's very effective in replacing, say, a single tooth or maybe just a couple teeth, and it works well for those people. It's all about identifying what are the conditions, what are your goals, what are your expectations and desires, and then matching up with the most appropriate treatment.
I think last time you were on the show, I mentioned it a little bit about, but my father actually did this.
Yeah,
and
exactly.
We talked about not only changing the way that you eat or the way that you consume everything, but it also completely opens you up.
It does. It's life-changing, and my father-in-law actually did it on him a number of years ago as well, and it's life-changing. It opens up avenues of life that these people either thought were gone, were hopeless, they were maybe unhappy, or they were depressed about it. It opens up those joys of life. It really is a quality of life thing. Allows them to interact, feel confident that when they're laughing and having a good time with their friends, their teeth aren't going to fall out, or at dinner they can go to a nice restaurant or eat the foods or eat a taco or whatnot and eat it just like everyone else and not be embarrassed about hiding that denture under the napkin, or they need to run to the bathroom, or I'll just have the bowl of rice while you guys eat the the meat or whatnot. So it really improves the quality of life, and it's very rewarding.
Do you run into some patients who actually want, because I would think, for me, and I haven't needed it or anything yet, but I would think the permanent solution is the best, but some of your patients want something removed?
As time goes on, more and more people, the vast majority of people desire something fixed or permanent in there, but there are people who are they're happy with something removable. It meets their goals, it meets their expectations. They want kind of a nice smile, healthy, but they're minimal on functional requirements. So this is a nice cost-effective option. We can do complete dentures, we can do over dentures or snap-on dentures, particularly on the bottom where it's particularly uncomfortable. So it's all about aligning appropriate treatment with what are you as the patient, what are your goals, what are your desires, what's your degree of expectation, and matching that appropriately.
Now, if somebody's thinking about doing this, one of the first things I kind of thought about, maintenance, cleaning, how's that differ?
Just like regular teeth?
It's for all intents and purposes it is. And so it's just like anything. You don't go out and buy a nice car, or any car for that matter, and not think there's a maintenance, and this is no different. So most patients, particularly those who do permanent or we do have their other teeth and other permanent solutions, we're recommending that they come in about every 3 to 4 months. The every 6-month thing is not oftentimes appropriate, and that's really based on 40 and 50-year-old, not even science, it was just a toothpaste ad. So we put them on that. But for other people with dentures or removable or other things, you know, sometimes every 4 to 6 months. So it's really tailored to what your individual needs are, and we help you keep these for the rest of your life. We're not just trying to fix you in the immediate for the day or the week or whatnot. We're trying to help you out and then sustain you for the rest of your life.
Wow.
Well, there's always so much to learn in these segments, and we can't cover all of it, but one of the things you guys do every month is your seminar. You got one coming up?
We do next week, next Wednesday at 6:30 p.m. at our Southside location. And that's wonderful. That answers a lot of questions. It kind of teaches you a common vocabulary so that when you do come to your consultation and spend the hour or two with us, you kind of have a higher level of understanding.
Good stuff. There you go. It's on your screen, and check that out. And we want to thank you and Jacksonville Dental Specialists for being here and sharing their services and information again. And for more information, visit jacksonvillehighbridge.com. You can also call 904-584-3867.